Enterprises, IT&E, and Jack in the Box. Proud to present this episode of The Link on a Monday. Dr. Hoa Nguyen joins us now in the KUAM News Link Zoom room. Good morning, Doc.
Good morning. Good morning.
Good morning. Well, first of all, just right out the gate, all morning long, we've been getting a lot of people calling up and complaining about, testing, backup, no appointments. They're not getting the results in a timely manner. I know you've been listening to the show, but just your reaction to that kind of stuff.
Yeah, I tell you, we were doing pretty good there with the Binax because the Binax is pretty simple to run. But the problem is we kind of run out the Binax. So we have a new test now called the Q test, and the Binax is the antigen test, so it's processed right there at the site because very simple to use, a little card. But with the Q test, it's a molecular test, and it's very, very, very good test. But unfortunately, you cannot run at the site. You have to run it in an office or back at the lab. And the Q test, it takes the full 20 minutes to run each test. So yeah, that's going to be more likely the reason why it back up so much. Because if you have to run 1,000 plus tests per night on the Q test or the PCR, it's going to get you behind pretty quick.
Doc, I also wanted to get your comment on the monoclonal antibody treatment has been closed until further notice. And I know that that's kind of like how we keep people out of the hospital. So are you concerned at all about that?
Yes, right now we know that the majority of infection are Omicron, but there's a few Delta still out there. And Omicron tend to affect people in the upper airway, but the Delta is still in the lower airway. So without the monoclonal antibody, there's a risk that the people get infected that might end up in the hospital. That's kind of the way that we trying to decrease the risk of hospitalization by about 80 to 85%. So I think that we're going to keep our eye closed very closely the next few days until we get to the new shipment coming in. I know there's a antiviral pill, the Paxlovid here on island already. They try to work out a system to see what the most efficient way to get it to the public. But I think that the earliest can get to the public probably Tuesday or Wednesday. So I hope that the process as easy as a monoclonal antibody, that the community provider can write a prescription and the patient goes somewhere and pick up prescription. That's the easiest way. But I think the process won't be out till about Tuesday or Wednesday.
Doc, the governor came out with an address last week in which she said that we're okay, GMH is protected, even though we're getting a lot of these, triple digit positives. She said that most of the cases are mild. Would you share her optimism about the state of the hospital?
Even on a non-COVID scenario, both GMH and GRMC most of the time the max capacity with the non-COVID patient admission already. As you can remember, even before the COVID come, sometimes the hospital you have people waiting in the hallway because there's no bed. So I think that any admission to the hospital, either GRMC or GMH with COVID patient, we create a lot of burden to the hospital and put the staff at risk. So I know that admission right now are over around the 20, but that's a lot of work for the healthcare provider and the clinical staff at the hospital. So I think that even the symptom are mild, we still prefer not to have anyone that in the hospital with COVID, or keep at least in a single digit number. So it's much more manageable, but you can see if you talk to the hospital, their clinical staff are also down, both hospitals because of infection. So they stress themselves out a lot more. So I think that we have to be very carefully um, kind of think that it's okay in the hospital. It's never okay. Like I say, even before the COVID come, we really need to be careful and try to keep the number of infection admission in the hospital as low as possible, like say in a single digit if we can.
Right, because it's not just like, when you see these COVID-19 hospitalizations, I don't know, but people may think that they get an image of that's all there is at GMH, but that's on top of an already overtaxed and overworked hospital.
Yes, it's not like the same people stay in the hospital. You discharge three, you admit three. So those are new patients. It's not the same people in the hospital. The admission, the length of stay is shorter, but it's not the same people. Like I say, you discharge them, you admit right away. So that's why the number don't go down that much, just because it's a new admission. So as you can see, the Omicron might be mild, it affects the upper airway, but they still have people admitted. And the one that we have to be very careful at this point, at the clinic level, what we see is that the positive number, mostly in the young one, 18 to 39, we have not hit the elderly with comorbidity. That's what we have to watch for. Once the infection Omicron spread from the younger one to the one with comorbidity in the elderly one, that's when we have to be careful, because the admission will go up on the elderly. They don't have the same immune system as the 18 to 39. So we are just at the beginning. We still have a few more weeks to go. So I hope that when it gets to the elderly with comorbidity, that they fare the same as the younger one.
I know Dr. Berg had thrown out a February 1st date to the end of the surge, but I was able to ask Dr. Annette David about that Friday, and she said that was a very hopeful estimate. Did you have any?
Well, from February 1st is next week. I really doubt that this is going to be over next week. Like I say, if we're lucky, if we're going to get by the end of February, it's going to go up still, and the number is still going to triple digit for a few weeks.
Oh man, sorry, ladies. We had a really good Valentine's Day planned for you, but your doctor's orders. We're gonna have to do this from 6 feet apart, if that. Doctor, was something else too I wanted to talk to you about. It's something that's been in the media.
I think that people have to understand that the vaccine are very good and keep you away from the hospital, the severity of the disease. But we know now the vaccine does not prevent you from getting infection. So we really highly encourage people to try to decrease the gathering as much as possible and practice your 3W as much as possible. Again, the vaccine does not prevent you from getting infection. The main purpose we know now is to decrease severity of the infection.
Right. Doctor, what's something else that's been in the media for the last couple of weeks relative to a couple patients who have filed complaints against local doctor Ugochukwu Okoma? And this has reached, I know that you caught the meeting with the Guam Board of Medical Examiners wherein one of these patients was trying to speak to the Board of Medical Examiners. However, there wasn't a public comment period in that meeting and she was kind of shut down. But come to find out, another patient has surfaced with similar complaints against the doctor. Did you have any comment on that, Doc, for audience?
We in the past have been kind of people say that we are not policing ourselves as a healthcare provider. I think that we need to do better in protecting the patient for any complaint, especially a complaint as severe as this one. So I think that if the complaint have been in November, I think the medical board need to move very fast and communicate that back to the public and to the patient to let them know where the process have been, right? I mean, that's just a transparency that the medical board need to to the public in order to let the public know that, hey, we are policing ourselves. I didn't say that the physician do anything wrong, but at a certain point, we really need to be very transparent to the public and keep them informed of where the process has been, and also communicate with the patient. I think it's very important that we have to communicate with the patient either offline or online, but we need to let the patient know that the medical board and physician do care about the patient's safety. I think that one thing that we have to hold ourselves the highest standard and ethic of them all. So we can. I think silence is not a good thing. Sometimes silence admits guilt, and it's not good in the eye of the public. So I think that I encourage the medical board member to at least reach out to the patient and update the public of where the investigation is at this point. So let the patient know that there's something done at this point, and not let them hang and no answer. I think to me, clear communication to the patient and transparency to the public is very important. So, I'm looking forward for the board to put a statement out, or GMA need to put a statement out somehow to let the public know that, hey, we take this very, very serious, and and we have to look into it. And again, talk to the patient.
Right, Doc. So this is the timeline of it is pretty interesting because I know the complaint was brought forward in November, but only at the last meeting was it revealed that Dr. Annette David will be in charge of investigating it. But what I thought was interesting was Dr. Berg had recused himself from anything to do with this complaint, but he was very active in preventing the patient from testifying at the meeting. How do we kind of like avoid the appearance of, because when people outside looking in, you know what it looks like, Doc? It looks like all these doctors are just sticking up for each other.
There's certain law and regulation that the medical board have to follow, and I'm not in the medical board, so I don't know. But even if they have law or regulation you have to follow, I think that need to be made public, so that way the public know that, hey, we just follow the rule right now, even if we don't like it. But the rule had to be followed, but we are doing something about it. I think that's important to be transparent and make the statement. Again, the whole thing about is that, the patient, the patient's always right. This is how I look at it, and you have to listen to the patient because that's what we take an oath for: protect the patient, do no harm. So we really have to live up to that oath and communicate and talk to the patient and work things out. You have to hear, even during the investigation, you need to let the patient know, hey, we listen to you and we're doing something about it.
Thank you, Doc, for your time on this Monday.
Yeah, it's okay, guys, but please be safe again. Try to do the 3W and stay away from any gathering. If you feel sick, you have symptoms, please go get tested. If you have close contact, just monitor your symptom and don't get tested too early. You gotta let people know that, if you get tested negative because you have close contact 1 or 2 days ago, doesn't mean that you're negative. You have to kind of isolate and kind of watch the symptom or quarantine yourself for the next 3 to 4 days or so, because you might be positive in about 2-3 days. So test negative, you still have to be cautious and watch the symptom. Okay, we have to somehow control ourselves this one because there's no restriction right now, so we have to control ourselves somehow to make sure that we can get through this surge with a little damage possible and less people that lose their life in this surge.
Right, Doc.
And so be careful when your herd immunity for COVID is not going. It's kind of out the window right now. So please don't get infected. Thing.
Herd immunity. I think I heard that one before.
Yeah, it's just not gonna happen. They change so much that that it's not going to be possible unless we lock ourselves on the island and let no one in and out. But it's going to be challenging. We'll have to learn how to live with this thing. But yeah, herd immunity is something not. I don't think that Omicron proved it wrong already.
Yeah.
So we.
Doc,
really
I didn't
need
want to
to-
open that thing you sent me, but did you say there was a new variant in, what is it, Denmark or something?
Yeah, there's a new variants that
God.
I know that we have to be careful, and it's Omicron cousin. It's much more infectious than Omicron. We just have to watch to see and it's or not.
Omicron, check your prim. Doc, just on what you said about the testing, right? Just for the record, if you're a close contact of a known COVID-19 positive, when should you get tested? Because I get a lot of messages or people find out, oh my God, so and so's positive. Can you help me get tested right now? And you don't want to
Yeah.
get tested right now, right? When?
Yeah, if you have close contact with someone positive, get tested anywhere from day number 4, number 5, but don't get tested the next day or the next 2 days because it's going to come back negative unless you're very symptomatic at that time. But if you don't have no symptom, be patient. Just wear your mask. You can go to work, but wear your mask and just be careful with people around you and get tested 4 or 5 days later, not sooner, just because you're wasting your time and really the test right now is going to come short with the kids, so we really have to encourage people to kind of test on the appropriate day. So day number 4, number 5, the best time to be tested for close contact if you don't have no symptom. Okay, so just wear your mask around people until you get tested.
Thank you, Doc.
You're welcome, guys. Just be good and be safe.
Right on. Let's do this another week. Let's get it. Monday, Dr. Hoa Nguyen, January 24th. Just a really super quick break like that. It's going to be so short. And Jason Salas is coming back with the state of tourism with Uncle Carl, former Governor Carl Gutierrez, the